Kirchner, who's the Chief Medical Officer at the North London Foundation Trust, who's going to talk to us about quality improvement. So Vincent, can you tell us why quality improvement is so important in the North London Foundation Trust?
So it is one of our priorities, and it really is focused around trying to improve quality, improve safety, improve the experience of both our service users and staff in the organisation. So it gives us all a methodology and a way of doing things in the organisation in a way that's safe, that's measured, using data, so that we improve things in a logical way. Of course, we've had many quality improvement projects happening, many projects have completed. We've done a lot of really, really positive things, including saving a lot of money. And one of the big projects has been the patient flow work with our inpatient services. And we've managed to almost eliminate sending people out of area for beds. So yeah, some really, really positive work happening around quality improvement.
Can you tell us a bit about your experience of quality improvement?
When I was first appointed as medical director in Camden and Islington in 2014, I had to write a clinical strategy for the organisation, and in that strategy I thought that quality improvement had to be one of our priorities in the organisation. So that's where my interest in quality improvement started. We fought for a small team. We had a brilliant team of very, very motivated people who built up a programme, and we had a flourishing quality improvement programme happening in the organisation. I loved it. I think everybody enjoyed participating, and we saw some positive impacts of that project. Unfortunately, the pandemic happened, and I think things more or less fell away. But I'm very, very excited that we now have the partnership with IHI, the Institute of Healthcare Improvement, and also our own quality improvement team, which I think is growing and building. So yeah, so I've been involved in quality improvement for a while. And continue to support it. Really happy with it.
Can you tell us what you think the benefits of doing a quality improvement project are for staff?
Well, so many of us come across problems in our day-to-day work that we think, oh, if only I could fix this. Quality improvement gives you that methodology, that permission to test ideas, to try things out, and to work out what will fix those problems. So really, really good instrument for us to use, and that's for all of us to use. I would say, sometimes we think of just particular staff groups, but actually this applies to everybody, whether you're somebody like me, or whether you're a nurse, whether you're a doctor, a pharmacist, a psychologist, an allied health professional, anybody in the organisation can use this methodology. Of course, always remember to link in with the quality improvement team so that your project can be registered on Life QI. But I want to also make a particular mention for our medical staff who are expected to do quality improvement as part of their appraisal, for resident doctors as part of the ARCP process. So yes, so some of us, we actually really do have to do it as part of our training, but for all of us, there's a massive benefit in doing quality improvement.
And can you tell us what your message is to staff at the North London Foundation Trust who want to do a QI project?
So first of all, maybe think of ideas, think of things that you want to improve. The next step is definitely talk to colleagues, garner some support around you of other colleagues who want to join in the project, and then go and speak to the quality improvement team so that they can also help you. I think it's important to make sure that you've done training, so there is a lot of training available around quality improvement methodology. It's not difficult, but it is just something you have to learn to do. And then of course there are opportunities like the Quality Improvement Showcase event. You can publish, you can go to conferences, you can do all sorts of things to talk about your quality improvement work, and hopefully that will help to give other people ideas to also do those projects.